नमस्ते सबैजनालाई। आज विशेष कार्यक्रम सधैँभन्दा अलि फाल्टै म हजुरहरु समक्ष आइरहेको छु। सर्वप्रथम सधैँ चाहिँ म हजुरहरुलाई भन्न चाहन्छु, यो जसले हेर्नु हुँदैछ, हेर्ने मेरा सबै फेसबुकका साथीहरुलाई शेयर गरिदिनु होला र तपाईलाई बीचमा केही कमेन्ट छ भने कमेन्ट पनि लेखिदिनु होला, जसको अर्थ चाहिँ म तपाईहरुको कोही प्रश्न रहे त्यसको जवाफ पनि दिन कोसिस गर्नेछु। र यति भन्दै आज म समक्ष डाक्टर के भनेर यहाँ मसँग हुनुहुन्छ। उहाँको छोटो परिचय म दिन्छु र त्यसपछि म नेपाली र अंग्रेजी दुईटै भाषामा बोल्दै छु। Dr. K, what I told is I just asked my Facebook friends to share this, what we are talking about, and in a minute I'll be introducing you, and after that I'll be speaking both in English and Nepali.
Okay.
Obviously I'll be asking you in English,
yes.
And I think you'll answer me in English, right?
Yes.
Then I'll interpret that into Nepali. May not be a perfect one, but I'll interpret as close as possible.
Okay.
Then I'll ask further questions moving forward.
Okay.
So with that, I'll read your introduction now.
Okay.
So Dr. K को परिचय म दिन चाहदैछु। Dr. K हुनुहुन्छ उहाँ चाहिँ independently licensed professional clinical counselor, अर्थात् उहाँ चाहिँ क्लिनिकल काउन्सिलर भनेर कोही पनि काउन्सिलिङ गर्ने व्यवसायको उहाँ हुनुहुन्छ व्यक्तिगत रूपमा। डाक्टर केले चाहिँ यो व्यवसायमा डाक्टर के began her career providing inpatient psychiatric care in a youth and adult and has experience working with person diagnosed with severe and non-severe mental health illness and substance abuse disorder. अर्थात् डाक्टर केले अगाडिदेखि नै जो मानसिक रोगका रोगीहरू अर्थात् मेन्टल हेल्थ सम्बन्धी कुनै पनि लागू पदार्थ सेवन गर्ने मानिसहरूलाई समस्या परेको छ नि उहाँहरूलाई त्यो समस्याबाट समाधानतर्फ लानका लागि त्यसको उपचारमा काम गर्नुहुन्थ्यो र वर्तमान अहिले त्यो काम पनि गर्दै हुनुहुन्छ र उहाँ चाहिँ अहिले एडम बोर्ड डाक्टर के currently serves as a vice president of advocacy and engagement at Alcohol, Drug and Mental Health Board ADAMH of Franklin County. अथवा फ्रैंकलिन काउन्टी एडम बोर्डको चाहिँ भाइस प्रेसिडेन्ट उहाँ हुनुहुन्छ। र यति भन्दै अब यस पछाडि म डाक्टर केलाई दुई चार शब्द सोध्दै जाँदैछु। Alright, thank you, Dr. K. I introduce you both the languages, English and Nepali.
Yes.
So, how are you today?
I'm doing well. I'm very excited to be here.
Alright, thank you. So, I introduce yourself a little bit. So, do you want to tell who you are yourself and in a nutshell, then we'll come back with the question.
Sure. So I have been in the field of behavioral health for over 28 years now. And I started, as I did hear you share, working in psychiatric hospitals, but I've also worked in crisis facilities, community behavioral health, college student mental health, and back into community behavioral health again. So as you can see, this is a life passion of mine.
All right, thank you. अघि मैले भने जस्तै उहाँलाई त्यही परिचय गराउनु भयो. So we talk about this thing in the past, and even also today in my introduction, I mentioned to my viewers about Adam Board. So what is Adam Board and what is the Franklin County and what does the board does? Can you just tell briefly about that?
Yeah, so the first thing I want to say is that the H in Adam H stands for help, health, healing, and hope. And our role in Franklin County is to plan, to fund, and to evaluate the behavioral health services that are offered to the community. We do not provide the direct services, but we do help to fund and partner with over 30 community behavioral health centers that provide direct mental health and addiction services.
Thank you. उहाँलाई मैले सोधेको थिएँ एडम बोर्ड भनेको के हो, फ्रैंकलिन काउन्टी भनेको के हो, बोर्डले के गर्छ भन्नुभएको थियो। त्यो एडम बोर्डले त ADAMH मा H जो छ यो H का चाहिँ चारवटा अर्थ छन् भनेर उहाँले बताउनु भयो। के भन्दा हेल्प भन्ने सहयोग गर्ने, हेल्थ भनेको स्वास्थ्यकर हुने, हिलिङ भनेको कुनै पनि समस्याबाट उपचारका लागि उपाय खोज्ने, होप भनेको कुनै आश केही कुरा आशातर्फ निराशादेखि आशातर्फ जाने यस्ता खालका काम गरिन्छ एडम बोर्डमा भन्यो भने एडम बोर्डले डाइरेक्ट भनेर उहाँहरूले आफ्नै सिधै कुनै पनि रोगीलाई अथवा समस्या परेका मान्छेलाई उपचार नगरे तापनि उहाँहरूले चाहिँ आर्थिक रूपमा संघ संस्थाहरूलाई सहायता गरेर समस्या परेका व्यक्तिहरूलाई रोगीहरूलाई उपचार गर्नका लागि सहायता गर्नुहुन्छ र एडम बोर्डले त्यस्तो खालको काम गर्छ भनेर उहाँले हामीलाई जानकारी गराउनु भयो. Alright, thank you, Dr. K.
Thank you.
Yeah, I just briefly explain what you told to me.
Yeah.
Now, tell us about Atom Board. You already mentioned about H in Atom Board. Can you tell me a little bit more about what is Atom?
Yeah, so I can sure maybe just go into our role of our team called Advocacy and Engagement. And our team's role is primarily to reach out into all of our Franklin County communities to ensure that we best understand what their behavioral health needs are. So if it's mental illness, if it's addiction, recovery support services, that's our team's role, is to reach out into the community to understand what those needs are. And in addition to that, we like to collaborate strategically with folks in the community to make sure that we are not only hearing what their needs are, but we are establishing a way to work together so that those needs can be met. And so we do. You want me to keep going?
All right.
Okay.
Thank you, Dr. K.
Okay.
It's always fun when we have two languages.
I know.
The question, right? यसो भन्दै गर्दा म तपाईहरु जो हेर्नु हुँदैछ सबै साथीहरुलाई म भन्छु प्लिज शेयर गरिदिनुहोस् र तपाईको केही प्रश्न छ भने प्रश्न पनि राखिदिनुहोस् अंग्रेजीमा भए पनि नेपालीमा भए पनि हुन्छ त्यस प्रश्नको जवाफ चाहिँ उहाँसँग म सिधै सोध्छु so I'm asking everyone please share it and if you have a question please put there so that I can ask your question directly to Dr. K when she is here. You can ask me afterward also but those questions needs to be I can answer maybe after some time but if you have a question right now if you ask me right now those answers are right here. So मैले उहाँलाई सोधेको थिएँ एडम बोर्डले के गर्छ अथवा एडम बोर्ड भनेको के हो त भन्दाखेरि एडम बोर्डले के गर्छ भन्ने कुरा उहाँको व्यक्तिगत रोल अथवा उहाँले के काम गर्नुहुन्छ भन्नेमा चाहिँ एडभोकेसी एन्गेजमेन्ट र रिच भनियो. एडभोकेसी भनेको के हो त भन्दा गाउँ ठाउँमा गाउँ घरमा सिटीमा जहाँ चाहिँ समस्या परेको छ भने त्यो समस्यालाई समाधानतर्फ लानका लागि को निर्णय गर्न सक्ने व्यक्तिहरुकासम्म पुर्याउने काम उहाँहरुको रह्यो भने इन्गेजमेन्ट विभिन्न तबकाका समाजका सदस्यहरुलाई अथवा अरू व्यक्तिहरुलाई कसरी चाहिँ ल्याएर चाहिँ एउटा इन्गेज अथवा सबैलाई संलग्न गरेर समेट्ने भन्ने विषय दोस्रो रह्यो र रिच भनेको तिनीहरुलाई कसरी भेट्ने जो ठाउँमा छन् त्यही ठाउँमा यस्ता खालका कुरामा उहाँहरुको प्रथम रोल रहन्छ प्रथम कार्य रहन्छ भने अनि बिहेभियरल हेल्थ रिकभरी सपोर्ट बिहेभियरल हेल्थ भनेको चाहिँ मानसिक रोगतर्फ अथवा कुनै पनि लागु पदार्थदेखि लिएर यस्ता समस्या परेका हो त्यसमा लागेका रोगीहरुलाई त्यसमा लागेका व्यक्तिहरुलाई चाहिँ समाधान कसरी चाहिँ त्यसको समाधान खोज्ने भन्ने पक्षमा उहाँले काम गर्नुहुन्छ अनि साथसाथै विभिन्न मान्छेहरुसँग कसरी मिलेर काम गर्ने र कुन किसिमले चाहिँ काम गर्दाखेरि धेरै भन्दा धेरै मानिसहरुलाई चाहिँ यो सुविधाहरु पुर्याउन सक्छ भन्ने चाहिँ उहाँहरुको मूल उद्देश्य रहन्छ. All right, thank you, Dr. K. Now, I mean, other part of this means I will talk a lot about mental health here from the before. So, why is mental health important? Why do you think it's important? Because generally speaking, nobody wants to talk about that.
Yeah.
Right? Do you think it's important to talk?
Absolutely. Mental health, everyone has mental health. I hear people say, I have mental health, but this other person doesn't. But the truth is that we all have mental health. And mental health impacts our thoughts, and it impacts our beliefs, and it impacts our behaviors. And so it's important to be able to recognize what those look like for yourself and for those around you, in case someone around you may need some additional support. So our thoughts impact how we feel, and on some days those may be really good days where we feel absolutely amazing, and there may be some times where we don't feel so good. And so where the mental health part comes in is when we don't feel so good for a longer period of time.
Thank you. मैले उहाँलाई सोधेको थिएँ मेन्टल हेल्थ अथवा मानसिक रोग भनेको के हो अथवा हामी कोही पनि मानसिक रोगको बारेमा कुरा गर्न चाहदैनौं के हामीले कुरा गर्नुपर्छ त भनेर मैले उहाँलाई सोधेको थिएँ. उहाँले भन्नुहुन्छ मानसिक रोग अथवा मानसिक समस्या मेन्टल हेल्थ समस्या भनेको प्राय सबैलाई हुन सक्छ. कसैलाई धेरै कसैलाई थोरै कोही बेला मान्छेहरुले मलाई छैन उलाई छैन भन्ने मलाई छ उलाई छैन भन्ने कुरा हामी सुन्ने गर्छौं तर त्यो नभएर सबैको आफ्नो आफ्नो बेलाको हुन सक्छ. र मेन्टल हेल्थमा भनेको मेन्टल हेल्थले भनेको हाम्रो शारीरिक स्वास्थ्यलाई पनि असर गर्न सक्छ भने साथसाथै आफ्नो आस्था आफ्नो विचार यी सबै कुरामा यसले असर पार्ने गर्दछ र कोही बेला यसो कुनै दिन तपाईँ जुरुक्क उठ्दा बिहान बेलुका जे होस् खुसी प्रसन्न भएको हुनुहुन्छ भने कोही बेला धेरै निराश भइएको हुन्छ र जति बेला निराश हुँदा केही काम गर्न अप्ठ्यारो परेको अवस्था छ भने त्यसैलाई नि मेन्टल हेल्थको समस्या भएको भन्न सकिन्छ भनेर उहाँले हामीलाई जानकारी गराउनु भयो। म सबैजनालाई फेरि भन्दैछु कृपया यसलाई सेयर गरिदिनु होला र तपाईँको क्वेसन छ भने क्वेसन पनि त्यहाँ राखिदिनु होला जहाँ कि त्यसको जवाब म यहाँ ल्याउन सक्छु। मसँग मेरो सहयोगी मेरो छोरी अदिति यहाँ बसिरहेका छन् र तपाईँको प्रश्न भयो उसले मलाई प्रश्न पढेर सुनाउँछन्। हस् त, इज द्याट एनी क्वेसन अदिति?
No.
All right, thank you. So, Dr. K, now I have another question for you. It's a little bit of funny question.
Okay. I'm ready.
Why did you choose this profession?
Honestly, I took a psychology class when I was in 10th grade, and it stuck with me. And I knew from that very moment that in some way behavioral health was going to be my entire career path.
Alright, thank you. I asked her, मैले उहाँलाई सोधेको थिएँ यो व्यवसाय चाहिँ किन रोज्नु भयो त भनेर सोधेको थिएँ। उहाँले 9 कक्षामा हुँदाखेरि साइकोलोजी भने मानसिक सम्बन्धी विज्ञान मानसिक विज्ञान सम्बन्धी विषय पढ्नलाई अगाडि बढ्नु भएको थियो। त्यो पढ्न थालिसके पछाडि उहाँलाई लगत्तै मेरो भविष्यको हुन सक्ने व्यवसाय यसमै रहन्छ भनेर उहाँले छान्नु भएको थिए। त्यसै कारणले उहाँले त्यो विषय छान्नुभयो भनेर उहाँले जानकारी गराउनु भयो। So now let's go to the real question that I get quite a lot in the community, and also that question for me as well.
Yeah.
So we call it, yes, I do agree there are mental health problems for many people.
Yeah.
Some people they acknowledge, and yes, some people they don't. That is whole different thing, right? But if we know that somebody has a mental health problem, how do we know what are the signs and symptoms? Okay, this person may need help.
Yeah.
This person may not need help. How do we find that out?
Yeah, so I think the first thing that we can do is realize again that we all have a mental health. So there may be signs or symptoms that may be happening to us, so that we need to pay attention to those things, ourselves. But when it comes to other people, and I'll make some references here because I want to talk just really briefly the difference between what you may see if mental illness is a concern versus what you may see if addiction is a concern. So let's start with mental illness.
Okay, let's see. मैले उहाँलाई सोधेको थिएँ अब हामी सबैजनालाई हामी भन्दैछौँ मेन्टल हेल्थको समस्या छ, मेन्टल हेल्थले कसैलाई समस्या पार्ने गर्छ भन्ने कुरा हाम्रो त कुरा छँदैछ। तर त्यो हुँदाहुँदै पनि यस विषयमा हामी गफ गर्न चाहदैनौँ र मैले उहाँलाई सोधेको थिएँ कस्ता खालका सङ्केत हुन्छन् र कस्ता सङ्केतलाई चाहिँ मेन्टल हेल्थको समस्या भएको हो भनेर भनेको प्रश्नमा उहाँले भन्नुहुँदै थियो अघि भने जस्तै हामी सबैलाई मेन्टल हेल्थको समस्या बेला बेला पर्ने नि गर्छ गर्न चाहिँ तर कुनै किसिमका साइन भनेको सङ्केत कोही चाहिँ कुनै लागु पदार्थ कुनै समस्या लागु पदार्थका कारणले गर्दाखेरि भएको समस्या हुन्छ भने कुनै चाहिँ मानसिक रोगकै कारणले भएका हुन्छन् यिनीहरुका बारेमा केही गफ गरौँ भन्दै हुनुहुन्छ। Alright.
Okay, so I'm going to refer to this here because there's a broad range and I don't want to miss anything in the space. So some examples may be if you're feeling sad, if you're worrying a lot or too much really about, anything that's happening in your life, especially if you are withdrawing from other people or you're isolating yourself, like staying in your room a lot and not connecting with other people. You're not taking good care of yourself. Maybe you're not getting up every morning. You're staying in the bed. You're not brushing your teeth. You're not taking a shower. Or you're in your room, like I said, for long periods of time. And then lastly, if you're around other people, but you're really not engaged. So you just don't have any motivation to connect.
Thank you. यसको जवाब उहाँले भन्नुहुँदैछ अब कसरी चाल पाउने त भन्दाखेरि पहिलो कुरा अगर तपाईलाई कुनै न कुनै कारणले अथवा कुनै बिना कारण धेरै नराम्रो लागिरहेको धेरै मानसिक रूपमा तपाईलाई दिक्क लागिरहेको अवस्था छ अब बिना बित्थामा चिन्तित कुनै डर लाग्ने बिना बित्थामा कोही बेला आफू जुन आफ्नो साथीभाइहरु छन् इष्टमित्र छन् ती इष्टमित्र साथीभाइदेखि पर जाने मतलब अलि पर भाग्ने एक्लै मात्रै बस्ने अथवा अरु मान्छेहरुसँग सँगै नबस्ने अनि सबै कतिवटा कुरामा बिल्कुल काम गर्न मन नलाग्ने अब अर्थात आफू अरु साथीहरुसँग बसिरहेकै भए तापनि कुनै पनि कुरामा संलग्न नहुने अर्थात आफू गएर बसिन्छ अरुसँग बस्छ अरुले अर्कै धुनको काम गर्छन् आफूले आफ्नो धुनको काम गर्ने यस्तो खालको संकेत तपाईमा छ भने चाहिँ मानसिक रोगले सताएको भनेर बुझ्नु पर्ने हुन्छ।
Okay, so for addiction, we may be looking at things like having sudden difficulties in relationships with other people. If you have an unexplained attitude, maybe mood swings, even to that regard. Maybe the friends that you're hanging out with are different than the friends that you usually hang out with. Neglecting responsibilities that are really important, like going to work late or not showing up at all, going to school late or not showing up at all. Maybe always borrowing money from different people to support purchasing substances, or even stealing from people in order to support substances. Using drugs under dangerous conditions, for example, driving. We should not be using substances in driving. And then some more visible things from addiction are maybe having clammy hands or face, or shaking, or sweating a lot. So those are some of the visible symptoms.
Thank you. It's a long list. धेरै लामो भयो है.
Yes.
अघि मैले मानसिक रोगका समस्या बताएको थिएँ भने साथसाथै प्लिज सेयर गरिदिनुहोस् है त. जसले हेर्दै हुन्छ सेयर गरिदिनुहोस् र तपाईँको केही प्रश्न भए प्रश्न पनि राखिदिनुहोस्. यी प्रश्नले गाउँघरमा सबैजनाकोमा पुगोस् र कसै न कसैले सुनेर यसको फाइदा होस् भन्ने हाम्रो उद्देश्य हो. हाम्रो औचित्य त्यति मात्रै हो र तपाईँ हामीले सेयर गऱ्यौँ भने नि अरूकोमा पुग्छ, सेयर गरिन पुग्दैन. र जसले हेर्दै हुनुहुन्छ सेयर गरिदिनुहोस् र साथसाथै कमेन्ट पनि लेखिदिनु होला है त. र मैले उहाँलाई सोधेको थिएँ कस्ता सङ्केत चाहिँ लागु पदार्थ सेवन गरेका कारणले भएका सङ्केतलाई भनिन्छ भन्दा उहाँले भन्नुहुँदैछ पहिलो कुरा चाहिँ जो आफ्नो सम्बन्ध छ, आफू नजिकको सम्बन्ध छ, सम्बन्धमा समस्या आउनु एउटा लागु पदार्थको सङ्केत हो भने अर्को अनएक्सप्लेन्ड एटिट्युड भनेको कस्तो कस्तो उटपटाङ खालको व्यवहार हुनु त्यो पनि लागु पदार्थका समस्याले आएको हो. अब मुडी भनिन्छ जस्तो आफ्नो तपाईँ बेला बेला खुसी हुने, बेला बेला धुम्म परेर बस्ने, बेला बेला बिना बित्थामा तपाईँको रिसाए जस्तो यस्तो खालको समस्या पनि भयो. अब आफूसँगैको साथीलाई अलि अगाडिको दिनसम्म, अलि अगाडिको समयसम्म चाहिँ राम्रो गरिराख्ला, बिचरा मतलबै नगरिदिने, के छ त्यसलाई यादै नगर्ने, त्यो खालको समस्या पनि भयो. अनि अर्को हठात जुन चाहिँ हाम्रो गाउँघरमा हुन्छ हठात इष्टमित्र आफन्त जो आफ्ना चिनजानका मान्छेहरूसँग पैसा अत्याधिक धेरै पैसा माग्ने, बिना कारणमा यता र उता विभिन्न किसिमका कारण बनाउने पैसा माग्ने, त्यो पनि लागु पदार्थको कारणले भयो. अनि कोही बेला त पैसा अरूसँग चोर्ने पनि, आफूलाई ड्रग्समा किन्नका लागि ड्रग्स किन्ने पैसा चोर्ने पनि त्यसको पनि समस्या भयो. र यस्ता खालका कुराहरू चाहिँ जो अब साथसाथै जब तपाईँको हातहरू कामिरहेको अवस्था, कोही बेला अनुहार पनि त्यस्तै खालको भएको अवस्था, यी खालका लक्षण देखिन्छ मान्छेमा भने चाहिँ ती लक्षणहरू चाहिँ कुनै पनि लागु पदार्थ सेवनका कारणले आएका लक्षणहरू हुन् भनेर उहाँले जानकारी गराउँदै हुनुहुन्छ. र साथसाथै तपाईँसँग कोही प्रश्न छ भने प्रश्न मलाई भनिदिनु होला. केही क्वेसनहरू छन् नानी?
There are 2 comments and 2 questions.
Can you ask the questions then? Or maybe you can share the comments as well.
So let me ask the questions first.
Thank you.
So the first question comes from Tulasiram Pokral. What could be the main key to identify mental health or depression?
Dr. J,
okay.
yeah.
You're good. Translate.
Maybe let me interpret that question here.
Okay.
तुलसीराम पोखरेलजीले सोध्नु भएको छ जुन चाहिँ मानसिक रोग लागेका सङ्केतलाई पत्ता लगाउने सबैभन्दा पहिलो अथवा के हुन् त लक्षणहरू चाहिँ भन्नुभएको छ. डाक्टर केले एन्सर गर्दै हुनुहुन्छ.
Okay. So some of those signs could be really just having a really low mood and not feeling motivated. Knowing there's things that you need to do, responsibilities that you have to engage in, but for some reason you just don't feel motivated anymore to do those things. And so again, that lack of not being able to take care of yourself like you used to, not having that energy for life like you used to. So those are some of the signs. Also crying. It could be something that happened and give you a reason. But again, when it comes to depression, it's more of how long you have been feeling that way.
र त्यो प्रश्नको जवाबमा उहाँले भन्नुहुँदैछ पहिलो सङ्केत चाहिँ रियली लो मुड भन्नाले अब धेरै बेरसम्म निराश भएर बसिराख्ने, उत्साह उमङ्ग नआउने खालको सङ्केत छ भने एउटा त्यो देखियो भने, अर्को कुरा हिजो अस्तिसम्म केही काम गर्नका लागि आफू सधैँभरि लागिरहन्थ्यो, काम गरिरहन्थ्यो, जाँगर चलिरहन्थ्यो, केही काम गरिन्थ्यो भने अहिले हठात् त्यो नआउनु अथवा आफूसँग उत्सुकता, मोटिभेसन भनेको उत्सुकता हराउनु त्यो पनि भयो। अर्को नट एबल टु आई फर्गेट द्याट वान, कुनै पनि काममा संलग्न नहुनु होला, मैले लेखेको थिएँ भुलिएछु। अनि हठात् मान्छे धेरै बेरसम्म रोइरहनु, यस्ता खालका सङ्केत चाहिँ यसका लक्षण हुन्छन् भनेर उहाँले बताउनु भयो। अर्को क्वेसन के छ नानी?
Would you also discuss about the ways to prevent suicide and how people take mental health support if they are in crisis?
Sure. So we were.
Let me tell that. आत्महत्याबाट वञ्चित गर्न बचाउनका लागि यस विषयमा पनि आत्महत्या नहुन दिनका लागि यस विषयमा पनि केही कुरा गर्नुहोस् न भनेर सोध्नु भएको रहेछ। अब डाक्टर खेले यसको जवाफ दिँदै हुनुहुन्छ।
Yeah, so one of the resources I'll point to answer that question is simple. The number is 988. We know that if there is a medical emergency that we would normally call 911. Now, as of July of last year, there is a mental health substance abuse crisis phone number, and that phone number is called 988. So when you call 988, a person who is trained to take your call will listen, will talk to you, will help you problem solve, and help you really establish some good next steps for how it is that you shared that you were feeling. So 988 is an excellent number to call if you're feeling that you may harm yourself in any way.
पहिलो कुरा चाहिँ यस विषयको आत्महत्याबाट रोक्नका लागि के गर्ने भन्दा सबैभन्दा पहिला जस्तो घरमा केही समस्या भइगएको खण्डमा हामी 911 कल गर्थ्यौँ भने आत्महत्याको सङ्केत देखियो अथवा तपाईँ आफैले पनि आत्महत्या गर्ने सोच आयो र यस्ता खालका कुरा आएको खण्डमा चाहिँ हामीले कल गर्ने नम्बर हो 988 यो नम्बरमा कल गर्नु पर्यो र पहिलो हठात् आफैमा छ्यामै अगाडि आएको समस्याको समाधानतर्फ जान सकिन्छ। किनभने त्यो नम्बरमा कल गर्दा बोल्ने मानिसहरू चाहिँ यसै विषयमा तालिम प्राप्त हुनुहुन्छ र जस्तो समस्या परेको भए पनि त्यो समस्याबाट बाहिर जानका लागि उहाँहरूले सहायता गर्नुहुन्छ। Okay?
I also just want to say that you can call 988 if you're in any type of crisis. So it doesn't have to be specific to harming yourself or having a substance abuse crisis. It could really be a crisis about anything you would consider as a crisis.
988 चाहिँ अरू नै कुरा पनि आपत परेको खण्डमा कल गर्न सक्नुहुन्छ, मेन्टल हेल्थको मात्रै कुरा नभएर। So Dr. K, out of curiosity, is that question a nationwide like 911 or only for Franklin County? How is that 988 works?
Yeah, so 988 is a national phone number. So this 988 number is just a lot easier to remember than the former Suicide Prevention Lifeline phone number. So this is that same line, and it is national. So no matter where you are, you can call 988 and get the same response.
नेशनल नम्बर हो, जुनै अमेरिकाको जुनै कुनामा हुनुहुन्छ भने पनि यो नम्बरलाई प्रयोग गर्न सकिन्छ। ओके, यस विषयमा हामी फेरि कुरा गर्दै जान्छौँ। यो सुसाइडको, I think there are more questions on suicide, but I'll ask afterwards.
Yeah.
Do you have any other questions?
Yeah, there are 2 more questions in the chat.
Okay.
So Tara Kanal wait, no, I already did that one. Sorry. Tara Kanal also asked, suicide is highly preventable, but one of the serious problems across all communities in the world. Would you not mind to ask her or post these resources for people in Central Ohio for seeking mental health? It is very important for us as the community nurses to educate our people and refer those people for seeking those support.
So, Dr. K, I think you can post the resources, right?
Yeah, we can absolutely make sure that the resources that we talk about today are posted online so that folks can have easy access to them. Also, if you go to the Adam H website and you click on resources, there will be a ton of resources. They're based on youth, adults, any type of mental health concern that you may need help with, you can go there and you can find them there as well. But we can still post.
All right. Thank you. If you can send me afterwards, I can post in the comment as well.
Absolutely, yes.
So जुन प्रश्न ताराजीले गर्नुभएको छ त्यसको लागि मेन्टल हेल्थका रिसोर्सेसहरू जो सेन्ट्रल ओहायोमा हुने एडम बोर्डमा हुने उहाँले मलाई भरे पठाउनुहुन्छ सबै कुरा म यो लिङ्कमा पनि यहाँ कमेन्टमा पनि लगाउँछु साथसाथै एडम बोर्डको वेबसाइटमा गएर हेर्नुभयो भने त्यहाँ पनि धेरैवटा यस्ता सुविधाहरू रिसोर्सेसहरू त्यहाँ पनि छन् धन्यवाद any other questions?
Okay. There is another one.
Can you speak a little louder?
Okay. There is another one. So this one asks is, I am OCPSA but expired recently. Can't I facilitate in the community?
OCPSA as in prevention specialist?
What is OCPSA?
Yeah, that's what I want to know. I think it may have something to do with prevention.
Maybe the viewers, can you just explain what is that so that we can answer that question?
Okay.
Okay.
Yeah.
I think we'll answer once we get
Once
that
we get the answer, yeah.
Any other questions?
No.
Do you have you say there are some comments, right?
Yes.
Okay.
So Tulasi Ram Pokhrel says, very good. Keep link with mental health, drug/abuse related specialist. Our community is in strong need. And then they also said, let her train some of our folk to reach out to our people. And then,
thank you. Definitely we'll do those things, right?
Happy to do training.
Absolutely.
Absolutely.
All right, thank you, Dr. K. As we move forward, I'll be continuously asking those questions there, right? And so, all right, now, we went a little bit into it, but let's go because with this question, I think we went a little bit into it. But let's say, unfortunately, we lost many people know in the community, a very prominent leader in the community died by suicide very last several days before. So it's very, very important that. So in that situation, if someone is experiencing thoughts or behaviors that mention where people in Central Ohio can go to help, like is there anything that we have concrete? Okay, here is the resource. Call this number. Go there. Do you have anything as such?
Yeah. So first of all, I'm very sorry to hear about another loss in our community. I would say with regard to resources, yes, we mentioned the Adam H. Board, but there are a couple of other resources I want to make sure. I just want to say the name of these agencies and their direct phone number so that you have them immediately. So we mentioned 988, the Suicide Prevention Lifeline. We also mentioned Adam H., our website for resources. Also want to call out the Center for New Americans. They are in Reynoldsburg, just off of Main Street, I think in McNaughton, in the plaza over there. And their telephone number is 614-261-3196.
Thank you, Dr. K. So मैले उहाँलाई सोधेको थिएँ अब गाउँघरमा तपाईँ जो सेन्ट्रल ओहायोमा बस्नुहुन्छ अब हठात आपद परो त्यो अवस्थामा के गर्ने त भन्ने प्रश्नको जवाब उहाँले भन्नुहुँदैछ एउटा त जो हामीले अघि 988 भन्यौँ त्यो नम्बर भइगयो त्यहाँ कल गर्ने दोस्रो कुरा ADAMH उहाँहरूको वेबसाइटमा गएर हेर्ने अब त्यो पनि तपाईहरुलाई भयो भने त्यसबाट अतिरिक्त अर्को कुन त भन्दा पहिलो कुरा चाहिँ सेन्टर फर न्यू अमेरिकन भनेर 1299 मैक्नोटन रोडमा छ पर त्यहाँको नम्बर हो त्यहाँ फोन गर्ने नम्बर हो अघि उहाँले नि भन्नुभयो 614-261-3196 614-261-3196 यो नम्बरमा कल गर्ने
I also want to say briefly what they can expect when they reach out to the Center for New Americans, some of the things they provide. So they do provide mental health and addiction treatment, but they also provide case management. So that's like social services support. They also do psychiatric care in case someone needs medication. They do counseling and substance abuse treatment. But they also do some other really fun things that help contribute to having a better mental health, which are yoga, karate, dance, meditation classes, and education groups that talk more about suicide prevention, mental health for women, men, and families, and so forth.
Any other resources that we have? Oh, that's all.
That's it for
That's
today.
okay, that's
yeah,
okay,
these
that's
are
all. Thank
really
you.
great resources.
Alright, so म सबैलाई फेरि भन्दैछु तपाईहरुले कृपया यो शेयर गरिदिनु होला र तपाईको केही प्रश्न भए राखिदिनु होला जो अघि हामीलाई राखिदिनु भयो उहाँहरुको प्रश्नले पनि धेरै जनालाई सहायता भयो होला अब म अन्तिममा प्रश्न पनि लिँदै छु अदिति do we have any other questions?
Okay, so we
I
have
have to speak a little louder.
so we have an answer for what OCPSA is, and that is Ohio Chemical Dependency Professional Assistant.
Okay.
Do you want me to repeat the question?
Please,
earlier?
yes.
So I am OCPSA, but expired recently. Can't I facilitate in the community?
It depends on in what way. So obviously you're very talented if you already have had that certification. So I think it would really just be a matter of what organizations would allow you to come in and do some prevention work or some education work in chemical dependency. But
तपाईको प्रश्न जो थियो उहाँले सोध्नु भएको थियो एउटा OCPSA म सर्टिफाइड हुँ तर त्यो मेरो सर्टिफिकेसन एक्सपायर भएको छ म गाउँ घरमा आएर केही सहयोग गर्न सक्छु भनेर प्रश्न गर्नु भएको थियो र त्यसको जवाबमा चाहिँ अब कुन संस्थासम्म तपाई काम गर्ने हो त्यसमा निर्भर रहन्छ किनभने तपाईको सर्टिफिकेसन थियो भने तपाईँ पक्का तपाई यो काम गर्न सक्ने तपाईको दक्षता क्षमता त पक्का छ तर कुन संस्थासँग आबद्ध भएर गर्नुहुन्छ त्यसमै निर्भर रहन्छ भन्ने खालको जवाब उहाँले दिनुभयो. Any other questions?
Yes. So this question asks it is very important to educate the community as a whole, but we have limited resources to do that. Are these trainings and certifications for community members to reach out in case someone is dealing with mental health?
So the question is, are there trainings available for community members?
There are, and I promise you, if you go onto the Adam H website and look at all the different 30 plus network providers that we are connected to, you will find trainings, educational trainings offered at those organizations or by those organizations in some way that can help support your knowledge as it relates to mental illness and education and substance abuse. Also, the Adam H Board provides trainings throughout the year. We've done suicide prevention, for example. I know somebody online asked about that, and we plan to continue to do that as well.
र उहाँले भने यस्ता ट्रेनिङ उपलब्ध छन् कि छैन भन्ने प्रश्न सोध्नु भएको थियो त्यो प्रश्नको जवाबमा चाहिँ यस्ता जो एडम्बसको वेबसाइटमा गएर हेर्नुभयो भने त्यहाँ हामी धेरैवटा सङ्घ संस्थाहरू छन् जसले यस्ता खालका तालिमहरू दिने गर्छन् र साथसाथै एडम बोर्डले पनि यो तालिमहरू दिने गर्छ जस्तो कि सुसाइड प्रिभेन्सन ट्रेनिङ भनेर हामीले गरेका थियौँ र यो ट्रेनिङहरू हामी गर्दै जानेछौँ. So, Dr. K, question: somebody has to pay? What is the pay? How much is what is the cost? Or are these training for free?
There are some that are for free, and there are some that are for a very small cost. And the reason why for some of those is because they may have just decided to, make it free for the public, or they may have received grant dollars that allow them to provide these trainings free for the public. So it really depends on what you're looking for and what you want to increase your knowledge in. But when you find it, that would let you know whether or not there's a price. I would probably start in that space with NAMI. The National Alliance on Mental Illness of Franklin County. They do provide a lot of community trainings, and the other organization I would consider going on their website would be Mental Health America Ohio, because they provide a lot of training, most specifically with suicide prevention as well.
धन्यवाद जसले सोध्नु भएको. थ्याङ्क यू डाक्टर के. अब सर्वप्रथम चाहिँ मैले सोधेको थिएँ ट्रेनिङहरू पैसा लाग्छ कि फ्रीमा हो भनेर. धेरैभन्दा धेरै चाहिँ फ्रीमा हुन्छन् र कतिको साह्रै कम्ती रकम पनि ल्या हुन्छ र साथसाथै नामी भने NAMI नामीमा गएर हेर्नुभयो भने नामीको वेबसाइटमा धेरैवटा ट्रेनिङ हुन सक्छन्. मेन्टल हेल्थ अमेरिका त्यहाँ पनि धेरैवटा ट्रेनिङहरू हुन सक्छन्. साथसाथै हामी पनि ट्रेनिङहरू भरे हाम्रो लिङ्कमा लगाउँछौँ, राइट? डाक्टर के, वी क्यान गेट दोज रिसोर्सेस, वी क्यान पुट इन आवर कमेन्ट, राइट? आफ्टरवर्ड्स.
Absolutely.
र जति अहिले भनेका कुराहरू तिनीहरूका लिङ्क पनि म एकछिन पछाडि भरे भोलितिर यहाँनिर सबै लिङ्कमा लगाएर तपाईँ हामीलाई यसमा जानका लागि सहायता गर्न सक्छौँ. Any other questions, Aditi?
So there is an elaboration on the previous question. So are there any trainings or certifications that can for community members to understand like the full problems, because there's obviously a lot of language and cultural barriers. So is there anything on that?
So some of those same organizations that I just mentioned, I'll probably also add ETSS, the Ethiopian Tewahoda Social Services organization. I do know really as a behavioral health field that we are striving toward more culturally and linguistically appropriate services for all of our communities in Franklin County.
अरू पनि तिनी सङ्घ संस्थाहरूले गर्छन् ATSS भन्ने अर्को संस्था नि उहाँले नाम लिनुभयो र यस्ता तालिमहरू हुने गर्छन् so maybe we can also work around and figure out few other resources in the future or maybe Adam Board can bring some of those training if there's a need enough, right?
We are available to do the trainings by which our staff are equipped to provide. So I would say that, you know, when we put these links about these different organizations, if you find a training that you're wanting to participate in, it may be one that the board provides, it may be one that another community organization provides. But again, our goal, my passion is to be able to train and educate our community members on mental illness and substance abuse.
यस्ता तालिमहरू कति छन् ती तालिमहरू त्यहाँबाट हेरेर हामीले गर्ने गर्छौं त्यहाँबाट भएका रिसोर्सहरू पत्ता लगाउने तर हाम्रो उद्देश्य भनेको धेरै भन्दा धेरै हाम्रा गाउँघरका इष्टमित्रहरूलाई यस्ता तालिम दिनुपर्छ भन्ने उद्देश्य हो र यी प्रश्नहरू सोध्दै गर्नु होला प्रश्नको जवाफमा हामी सायद धेरै जनाले यो कुरा सोध्यौं धेरै जनाले कुरा आयो भने नयाँ तालिम पनि ल्याउन सकिन्छ if there's a big demand we might start thinking how can we address that need so please watch this put your question put your comment and we'll come out with a solution in the future. So
can I give one more resource that's excellent for youth? So Nationwide Children's Hospital has a Center for Suicide Prevention Research. You can literally Google Nationwide Children's Hospital and suicide prevention. On that website, this particular team goes into the community when they are called into schools, into organizations, and they provide a number of different suicide prevention training specifically for youth. You can also just Google On Our Sleeves, which is another great resource for youth that's also sponsored by Nationwide Children's Hospital. Teaches you how to have tough conversations with your kids about mental illness and drug use.
विशेष गरेर हाम्रा युथ भनेको वयस्क भाइ बहिनीहरुका लागि चाहिँ नेसन वाइड चिल्ड्रन हस्पिटल भनेर जो संस्था हो त्यहाँ गुगल गरेर खोज्नु भयो भने त्यहाँ धेरैवटा मानसिक रोग सम्बन्धी अथवा सब्स्टेन्स युज अथवा कुनै पनि लागू पदार्थ सम्बन्धी यस्ता विषयका लागि तालिम दिने धेरैवटा व्यवस्थाहरू त्यहाँ छन् त्यहाँ गएर त्यो व्यवस्थाको फाइदा लिन सक्नुहुन्छ ती सुविधाहरु फाइदा लिन सक्नुहुन्छ On Our Sleeves भनेर अर्को पनि छ त्यहाँ तपाईले त्यसलाई पनि गुगल गरेर हेर्यो भने त्यहाँ पनि ती सुविधाहरु हुन सक्छन् साथसाथै ती सबै लिंक अहिले भरे म कमेन्टमा पनि लगाउँछु र तपाईहरु त्यो पनि खोज्नु होला भरे कमेन्टमा पनि आउने गर्छ. So any other questions, Aditi?
No.
All right, thank you. So it's been much longer than what we thought, right?
Yeah, okay. This is great.
So Dr. K, what are your final thoughts on this for our viewers, the listeners?
Yeah. I'd say that my final thoughts are that if you're feeling any of the ways that, you know, I just explained regarding mental illness or substance use, or maybe you see that in another person, don't be afraid to say something. And if you are that person, don't be afraid to go to counseling. I'm a counselor. I have a counselor. There's nothing wrong with that. Everyone needs someone to talk to. And I like this button that I see on the back of your camera here that says life is better with you here. And that is very true. Very true.
मैले उहाँलाई सोधेँ तपाईको फाइनल अन्तिममा जाँदा जाँदै तपाईको केही भन्नु छ भन्दाखेरि उहाँले मलाई भन्नुभयो अथवा त्यो प्रश्नको जवाबमा भन्नुभयो जाँदै भन्ने कुरा तपाईलाई कुनै पनि बेला दिक्क लाग्यो अथवा मलाई यो जीवनबाट बाहिर जानु जस्तो लाग्यो अथवा कुनै त्यस्तो खालको विचार थट तपाईको टाउकोमा आयो भने आफू मेरो सहायता पाउने ठाउँ कहीँ छैन भने निराश नहुनु होला तपाईले कहीँ न कहीँ भन्नु होला अथवा कसैलाई परेको छ भने कसैलाई भन्नु होला भन्नियो भने त्यसको समाधानपट्टि जाइन्छ. अब लाइफ इज बेटर विथ यु हियर भनेर जो मेरो क्यामेराको पछाडि लेखिएको छ वस्तै तपाई यहाँ रहनुहुन्छ भने यो जीवन तपाईसँगै मेरो जीवन पनि खुसी रहन्छ राम्रो रहन्छ र बाँच्न र अरूलाई पनि बचाउनका लागि कसैलाई भनेर सहायता खोज्यो भने सहायता पाउन सकिन्छ। यही कुरामा हामी यो आजको कार्यक्रमलाई स्थगित गर्न चाहन्छौँ। अब म भन्नको साथसाथै अन्तिममा जाँदै तपाईँहरू सबैलाई म एउटा फेरि सल्लाह सुझाव पनि माग्न खोज्छु। यो आजको कार्यक्रम कस्तो लाग्यो र तपाईँले कार्यक्रम ठिक लाग्यो बेठिक लाग्यो, यसले कुनै सहायता पुग्छ जस्तो लाग्यो सहायता पुग्दैन जस्तो लाग्यो, यी सबै कुरा चाहिँ तपाईँले कमेन्टमा लेखेर मलाई सहायता गरिदिनु होला, जसका कारणले गर्दा चाहिँ यो कार्यक्रममा फेरि पनि लिएर आउन सकौँ भन्ने आश गरेको।